I want to take just a minute here and tell you what we're here today discussing and is on everybody's mind is Insure Tennessee, and will this state adopt the program proposed by the government. Probably some of the things I'm going to say, some of you are not going to like, some of you may walk out and leave on me. I think this Affordable Care Act, for me, philosophically, is one of the most atrocious bills that ever came out of Washington, D.C. that's put upon our country. I mean, I absolutely do. It's not very, doesn't make me feel very well to know now that the federal government is in control of the largest industry we have in the United States. But you have to drill it down, and what does it do to our community here? Do you realize that West Tennessee Healthcare now has about 150, 160 less employees today than they did a year ago because of adjustments and cuts that needed to be made because of the money that Affordable Care Act is taking out of this facility, sending to Washington to fund Obamacare. Those are real jobs, real people in our community. He estimated that if this Insure Tennessee is passed, it potentially would add $5 million to the bottom line of this institution. Now, what does that do? It allows this institution to not have any reduction in workforce. It allows this institution to make market adjustments in salaries to help to compete in this healthcare industry. There is big competition for nurses and practitioners and technicians and things like that. And in order to keep up and keep that turnover rate acceptable, we have to adjust to what today's world is. We've had one hospital in Haywood County, it's closed. We have another announced closing in Somerville. Now, if we had Insure Tennessee, would they still be open? I don't know. But I think there's one thing for sure. If we don't do something, we will have other rural hospitals across our state that will close their doors. And that will be health care lost within those communities. So how many jobs does it make? How many does it affect? As I said, I totally philosophically disagree with Obamacare. But you know, it really doesn't much matter what I think about it. It is the law of the land, and I think we've got to we've got to live by the law of the land, but we don't have to die by the law of the land. As every successful business does, and every successful business person in this room, you have to adapt to the environment, and you have to adapt to the change dynamics that's going on in your business, and that's what we've got to do in healthcare. But in order to do that, we're going to have some help to fulfill the mission of this institution and the other institutions across this state that provide care to everybody that walks in the door. I used to be on the board of this institution, and when I got on the board 17 years ago, the uninsured and indigent care was somewhere around 3 to 4%. Today, it's 10% plus walking through the door. But every person that walks through that door gets the same treatment as any other person with insurance or with money to pay for it. That costs a lot of money, but that is the mission of this institution. As I understand it, Insure Tennessee will pump about $1.4 billion a year into our state economy. Now, I ask you, if this was an industry, if the state was recruiting this industry, how much incentives with our state tax dollars would the state give to get a business to invest $1.4 billion in the economy assured for 2 years? I think you would agree that the state would go out of the way to try to do what they could do to get that industry here. That's where we are. I mean, that is where we are. And it gets down to how is that going to affect our local health care system? And believe me, it is affecting it. It will continue to affect it. But we will do what we've always done, and that is take care of the health of this community. We need help, and we need help through this Insure Tennessee. These fellows sitting over here, they're state legislators, as Kyle mentioned earlier, are getting all kinds of pressure and calls and criticism, or talking about voting against this. And I personally believe, that it's purely on philosophical reasons. I believe that each legislature needs to think about and look at, how does it affect the people in the community they live and they represent? And I'm talking about people like sitting in this audience here. I think they need to think about the impact of this as well as the impact over the overall state. I get a little emotional or a little wound up when I start talking about this because this healthcare has been a part of my life as far as organizations for about 17 years, and I see and know what this institution has meant to this community as well as our partners out on the bypass and regional hospital. We have to have the healthcare system. We all want, what do you want? You want the best care you can get when you walk in the door. We've got to assure that that's available to our people. And then the people who, as somebody mentioned earlier, that I feel like will benefit the most from this program are our working poor. Folks who go to work every day, maybe have a family, cannot afford insurance. So, by and large, I think it comes down to a philosophical decision, and we fought that philosophical battle in Washington, and we, my side, conservatives, we lost. It is the law of the land, and let's make the best of it. Thank you.